All right. So first of all, thank you everybody for signing up for the Patora workshop. For those CMS providers who want to get some Con Ed, thank you for coming on. This is our very first Patora workshop. The goal is to try to bring some education. It's easy Con Ed for those with EMS certifications, those who ask me about nursing and other certifications. I will send out a certificate of completion, so hopefully you can get some credit out of it. Um,
Day.
Linda and Larry are great presenters. They agreed to kick it off. Um, so right before I turn it over to them, just a few quick housekeeping rules. Obviously, it's virtual, it's 2 hours, so you guys can get up and go as you can. But if you, to get credit for tonight, if you could just put your full name into the chat, this way I can check you off on my roster. Because I will be turning off my camera. This way I'm not a distraction as I'm working behind that. Um, about halfway through, I may ask just to see that you guys are awake. So I might pop a question up in the chat if you guys can respond. That's just a state requirement for virtual classes, just to show that you're still there. And then at the very end, I will put out a survey again asking for your thoughts on how our instructors did, how this class did, and then any ideas for the future, improvements, stuff like that. So hopefully we can just keep doing this. The goal is every quarter, every couple of months, we'll have a new subject and keep it interesting for you guys. So with that, I will turn it over to Linda and Larry.
Okay, well, thank you very
Thank you.
much, Eric. I'm going to go ahead and share my screen, get that going here, and then we'll introduce ourselves. Just go to slideshow. Okay, can you all see my screen? Eric, is that clear?
Yep, I can see it.
Awesome. Okay. So I'm Linda Laskowski Jones. My background very quickly is I've been a nurse for a lot of years, like we're going past 4 decades now. All in emergency and trauma. I am a patroller with Blue Mountain, and I've been a patroller for 35 years. I'm also an NREMT and uh, love the outdoors, and hopefully this is going to be a talk that I think everybody's going to take something away from. Larry?
I'm Larry Jones. I guess I started in 77, 78 with advanced first aid and at Delaware ambulance course before EMT existed. We became EMTs later. I met my wife in the back of an ambulance. Um, it was a great way to pick up girls back then, but she was actually crew. And been a patroller at Blue Mountain for, well, 46 years as a patroller and 43 of them at Blue Mountain. And as Linda said, we've been EMTs, I think, since the early 90s.
And then actually, yeah, prior to that, Delaware had ambulance attendants,
Mhm.
and we were ambulance attendants prior to that. So
And we love this topic. We're both fellows in the Academy of Wilderness Medicine through the Wilderness Medical Society, which we joined back in about 20 years ago as a way to combine our love of the outdoors as well as pre-hospital care.
and anyone that wants to talk to us more about that, we're happy to always talk about it. But for this presentation, we're really following the
EMT
EMT
curriculum.
curriculum as well as the National Ski Patrol. So without further ado, we're just going to go right into it here. And just to give you just a very quick overview of some of the objectives, we're going to talk about heat and cold. And so obviously we're going to talk about the manifestations of heat illness. We're going to focus on pre-hospital management of heat illness, and then get into hypothermia and frostbite, as well as the prevention strategies and the survival strategies for both heat and cold.
And we're going to end with a couple of short videos on subjects related to, as particularly hypothermia, which involve cold water immersion, which are very interesting and great survival techniques.
So something to look forward to. There's an introduction to the topic in general. You know that environmental injuries are pretty common. Heat and cold being the two most common of those environmental injuries. Heat-related deaths are skyrocketing. Over the past year, 2023, since that was our last complete year, there were more than 2,300 deaths in the US as a result of heat illness. And it is the third major cause of death in adolescents. And it makes sense that the injuries, the injuries peak in August, because that's the time that the kids are going back to school and they're starting with their, you know, training that they're doing for football and for other outdoor sporting events, and they're not acclimated. They may have spent the summer watching, you know, video games or playing on the computer, and they're not used to being outdoors. So
Right.
this is an area that we really want to focus on, is, you know, how to recognize it,
Right.
because how you treat it is critical to survival of the patient. So hypothermia, just in a nutshell, time you have a patient who's hypothermic, your trauma, morbidity, and mortality, you know, how sick they are and their mortality rate go up. And we'll talk about why that is, and again, how to prevent it. And then the issues with frostbite, and how unrecognized or improperly treated frostbite can lead to amputation. And again, we'll finish up with those prevention and survival strategies, which are so important.
And I think one thing to consider, especially a lot of us are patrollers, or even if you know you're strictly urban EMS, why is a lot of this happening? There are a lot more people getting out into the, call it the wilderness, the outside. Not all of it's urban, not all of it is in, you know, in the community. There are a lot of people who are exploring the outdoors in both the summer and the winter, which leads to this increase in, you know, heat illness and hypothermia.
So we've all seen the principles of thermoregulation, and probably there are some of us who never want to see it again. But it's worth at least going through here, because the principles of thermoregulation apply to heat as well as cold injuries. So just as a refresher, conduction would be the heat you lose or gain. In the case of a heat illness, you could actually gain heat if you're sitting on the black asphalt. So imagine that EMS patient who's laying out on the asphalt, and that asphalt is really hot. Not only can you have burn, but you can actually become hotter, right? By the same token, if you're sitting in snow, you're losing heat through your butt, or if you're laying in the snow, through your whole body. Convection is essentially the wind moving over your body and carrying away the heat that you're producing, and that would be wind chill. Evaporation, you know, you are constantly evaporating the moisture off of your skin. And if you're wet, you're going to have a greater degree of evaporation, and you combine that with some wind chill, and your body temperature can really plummet. Radiation is that normal heat loss that you get of the heat radiating, literally, you know, coming off your body in waves. And then respiration occurs when you're breathing in room temperature or cold air, or in some cases, warm air, right? It depends on whether it's hot or it's cold, how it's going to affect you. And then exhaling, and in your exhalation, you're losing body heat in the cold, right? And then you're inhaling cold temperature air, but you're also losing fluids, right? So if you're not keeping up with those insensible losses, you're also going to be dehydrated just from the act of normal respiration. So when we look at, I just have to click an OK here. It was blocking half my screen. When we're looking at, you know, heat-related illnesses, there's a number of predisposing factors to consider. So high environmental temperature and high humidity are those two factors that are going to be the most important to think about. But then, you know, who is the person who is most at risk. It's those people who are in the extremes of age, the very young and the very old. People who have cardiovascular disease are at higher risk. People with fever, people who have other types of chronic illnesses, or they have psychoses. And the psychosis, the reason that is that one, they're often on medications that can increase their risk. And we'll talk about that very shortly. But they may not realize the need to cool down. And it's that impaired judgment that can make them at higher risk for hyperthermia. Strenuous exertion, or even just chronic heat exposure, right? The person's living in an area, there's no air conditioning, and they don't have a way of cooling themselves. And then, of course, the situations that occur through, dehydration, that may just be that we're not replacing losses, or through illness, such as gastrointestinal illness, people who are tired, they're sleep deprived, those people who have any types of burns, including sunburn, are at higher risk, and people who drink energy drinks. Now, for many years, I coordinated the medical tent for the Delaware Marathon. It was probably more than a decade of doing that. And one year we had the person out there who was selling energy drinks, and it was just this promotional thing that nobody expected. We had more people come in with heat-related illness, as well as some pretty major cardiac events from the tachycardia. And it's like, get the guy who's selling the energy drinks out of here, because the medical tent was literally overloaded. People who have a high body mass index are at higher risk, and anyone who is poorly conditioned or has not acclimated properly to the heat, which may be at least 5 days of exposure to heat. And for many individuals, it takes longer than that 5 days. Why is my slide not? There we go. So there are some medications. Oh, did I skip one? I'm sorry. Take it back.
There you go.
Okay. Yeah, and there's a number of occupational risks.
Occupational
We
risks.
want to be part of a team to help us get access to people in Western North Carolina, and likely coming up.
Athletes, particularly beginning of the season, when you see the news stories about professional athletes, or especially young athletes, student athletes, when they're collapsing or having medical issues regarding the heat, it's usually the beginning of the season before they've acclimated. They've come off summer, they're going into their preseason training. It's hot, but it's not yet the fall weather. And suddenly they're exerting themselves strenuously, and they're collapsing as a result of heat-related illness because they haven't acclimated. The same goes for the military, especially boot camp, where they're really being stressed, and they're not used to it, and they're very often in very hot, humid environments. Construction workers and laborers, even if they're out there every day, when you get these periods of very hot, humid weather and extending for days or weeks at a time. And very often these guys are on the clock, and they're working hard and not getting a lot of breaks and not getting a chance to cool off and hydrate. Same with the agricultural workers, especially agricultural workers, very often migrant workers. They also have a strong association with the development of chronic kidney disease, not only because of the repeated heat exposure and illness, but because they're not getting the needed breaks, the cooling off periods, and the proper hydration while they're out in the fields. And probably what we see most often, firefighters. They're not, it's intense, strenuous work. It's not only in the summertime in a hot, humid environment, and then you add the heat and the strenuous activity inside a burning building. And it's extremely important to consider the firefighters, if you're on EMS and you're on EMS standby at a fire scene, to get these guys rotated out, cooled off, and hydrated before they go back on the line.
Okay. There we go. So medication use. So there's a number of medications that people take regularly that may predispose to heat illness. And so when you're taking a medication history, anyone who's on antihistamines, so think about Benadryl, Claritin, Clarinex, all of those types of antihistamines, the over-the-counter ones, the prescription ones, all of them will actually predispose the person to having a higher incidence of heat illness. Anticholinergics, a lot of the antipsychotic medicines are anticholinergics, but anticholinergics are also antihistamines. They're in that same category. And many medications that people take have an anticholinergic effect. Beta blockers, which are often given for blood pressure or cardiac conditions, can do it. ACE inhibitors, they're for blood pressure. Diuretics, again, you're losing fluid with diuretics, and that may predispose to dehydration, which is a risk factor in and of itself. And then there are those medications that people are using recreationally, like cocaine, PCP, and amphetamines. And even in the absence of high environmental temperature, as an emergency department nurse, I saw people come in with cocaine on board, as well as PCP and amphetamines, having very high levels of body temperature, simply as a result of those medications. So one of the problems that can develop, particularly in athletes, so for example, like what we were covering, adventure races or marathons, or even just strenuous physical activity outdoors, you can develop heat cramps, painful muscle spasms, and these usually involve the calf. And they're not serious in and of themselves, but they're considered on that continuum of heat illness. And oftentimes what people do is they think, I have to drink a lot of water. So they are drinking a ton of tap water. And tap water will help kind of wash out the sodium, which is in your body. And so you actually get hypotonic. You get too dilute, right? And you don't have enough of the salt. And that lack of sodium in your body is what is causing those heat cramps. So you get into these really bad muscle spasms. I mean, people are literally writhing with these. They would come into the medical tent and you take a history and you found out that, for every water station, they just drank a ton of water. And now they're literally rolling from side to side, holding their calves. And what it takes is to replete that sodium. So they need to take in things like half strength Gatorade. And I think I do have the treatment here next. Any type of oral sodium. However, don't give salt tablets. Salt tablets are definitely not the thing to do to replace the sodium. It has to be much more gradual. The salt tablets are way too hard on the stomach and can cause a lot of gastric distress. And they also need massage. And so if you're ever covering an adventure race, it's really good to have the medical tent right next to the massage tent because they can lick the salt off the pretzels and start to eat and start to get that sports drink in. And then somebody can literally be massaging out these rock hard spasming muscles that you can actually see and feel. Most of the time, that is going to recover those patients very, very well. Not usually the case that they need to be sent out by ambulance. However, if they're not getting better with these types of treatments, with the licking of the salt and, having some time to kind of come back to themselves in a cooler environment, then they may need to go to the hospital and actually get some laboratory measurements of their serum sodium and other electrolytes in their blood. And they may wind up needing some IV normal saline in the emergency department.
One thing to point out too on the sports drinks is, as Linda said, the recommendation is typically half strength sport drink. So many of the sport drinks are full of sugar, number one, and some of them have a load of protein in them, both of which are not going to be easily drinkable, and your patient will typically be throwing them back up if it's too sweet or a lot of protein. So kind of start them off light on a half strength sport drink and work them up as they feel better.
Yeah, this is a pretty miserable condition. Many of you may have experienced it at some point in your lives. But that is indeed how you prevent it. You want to both take in food, usually some saltier food in the heat, as well as your water or your a Gatorade or a sports drink of some sort that you enjoy without the protein. The other heat illness that's important to understand is heat syncope. Now, this is what happens when you're standing in one place for too long, and essentially your blood vessels widely dilate in your legs, and your blood literally pools in your legs. And ultimately, you're not getting adequate perfusion to your brain, vital organs. You start feeling faint. You start getting very nauseated, and then your heart rate shoots up, and then you can actually get bradycardic as well, and your blood pressure falls, and then you faint. Now, embarrassingly, I had this happen, of course, at a ski patrol event, with all the patrollers there at a winery. I took one sip of wine, was too warm, and literally, you know, went to ground.
Lightweight.
Yeah, it was just an amazing experience that I will remember for a long time, and I'm sure there's some people on this call who remember.
I've seen athletes using.
Yeah,
Heat syncope. We see this often at marathons. It's not the runners, it's the spectators
Mhm.
who are standing there for a couple of hours waiting for their runner to come in. And the other place you commonly see it is big concert events. A lot of heat, a lot of humidity, a lot of people, they're standing around. Of course, they're only drinking water, and they're standing in one place waiting for the band, and they go down there.
So it's pretty simple to manage these folks. They usually come back pretty well. You want to get them into someplace cool, or at least get them out of the direct sun, and assure they have adequate airway breathing circulation. And always consider there could be a more severe heat illness. So, if there's a mental status change, as we'll get into, it could be potentially heat stroke and not heat syncope. But if they come back and their mentation is okay, the chances are it is heat syncope. Again, you have to also rule out, or consider, could this be a cardiac event or some other, is there some other reason that they would have gone to ground? We want to loosen any restrictive clothing if they're wearing something that's like way too hot. You can imagine the people out there, like they're dressed in black or something on a 98-degree day and high humidity and, full sun. That'll do it certainly. And then use active cooling measures. Now, we've all been taught to use the cold packs to the head and the neck and the groin, and that's fine, and you can do that. But the most current research on this topic has shown that you have an incredible amount of surface area in your arms and in your legs. And if you can wet those arms and legs with cool water and then fan, you can get a lot of evaporative cooling, taking advantage of the mechanisms of heat gain and heat loss, right? In this case, heat loss on those forearms and legs to lower that body temperature very, very quickly. And elevate the legs, because elevating the legs is going to give you a little bit of return of blood from the lower extremities, into the core, and you will get better circulation as a result. Now, Larry and I were talking earlier, and when he's working outside, we've got a lot of like vegetable gardens. He comes in, and this is the technique. You just roll up your sleeves and just put your arms under that cold water right out of the faucet, and it really does bring you back very, very well. So do keep that in mind for yourself if you're working outside and you feel like you really need something to cool yourself down pretty quickly. Okay. So heat exhaustion is the next in the sort of severity levels of heat illness. And heat exhaustion is much more serious than these others, and it is usually caused by people who have lost a lot of fluids. They are dehydrated. They haven't had adequate oral intake, and I'm not just talking about plain water, right? It's both fluids and electrolytes. So food, salty foods in particular. it is a precursor to heat stroke. So if you don't recognize and treat heat exhaustion properly, it can then progress. And if a person has had an episode of heat exhaustion, uh, and they go back out into the sun, they are much more likely to have a heat stroke. So it is kind of an additive effect. Now, hugely important, people with heat exhaustion have a normal mental status. They feel terrible. They feel flu-like. So they're nauseated, they're weak, they could be dizzy, they are perspiring. And if you were to measure their body temperature, it may be slightly elevated because again, they're out there, they're working, they're in the sun, but it's not excessively elevated. So normal mental status though is your key here. And what happens in this case is because they are so dehydrated and because usually they've depleted their sodium, that's where the weakness comes in. When your sodium drops, and dehydration too, you know, to a point, the weakness will occur. The lightheadedness, I talked about that fatigue or the malaise. And they may have nausea and they may or may not vomit. The headache is part of that dehydration. People are incredibly thirsty here, but they don't want to eat. So again, you're doing maybe you're doing a coverage of a mountain biking, and it's a hot day, and the person comes in and they look like this, and you're thinking, oh, I've got to get them to eat something. You can't do it right away because they're going to throw it right back up again. So we had our own way of handling this with the marathon. And the first thing is just to do the sips of that, well, I'm getting ahead of myself again. I'll come back to this. I'm sorry. So if you're assessing them right now, you're seeing tachycardia, so high heart rate, tachypnea, high respiratory rate. They are just saturated with sweat, right? Profuse diaphoresis. Their blood pressure is on the low side. And again, they may have an elevated body temperature, but it should be less than 104. And that's still, you know, pretty high, but it won't be beyond 104. Normal mental status. And I mentioned again, it can progress to heat stroke, just making that point very, very clear. So what do you do about it? You have them stop their physical activity. You get them out of the heat, out of the direct sunlight. If there is an air-conditioned building or air-conditioned ambulance, rig, get them into that. You know, get the restrictive clothing off, and again, do the cold packs and soak them in cool water. The forearms and the legs, take advantage of that surface area of those blood vessels, and then fan them, right? To again take advantage of that evaporative cooling. And when you're helping them sort of come back to life after this because they feel so terrible, they feel like they're going to die. Uh, you're always careful about that nausea and vomiting and be ready for it. So have your barf bags there. Get ready to go. You can't just give them pure tap water typically and food, right? Or else that's again where you may get more vomiting. So what you want is that low, that half strength carbohydrate sports drink, and that is better tolerated. Or if you're going to give them cold water, if that's all you have, just sips. Don't let them guzzle, because again, that will cause them to be more likely to vomit. So what we would do is give them the half strength Gatorade. And when they thought they could handle it, again, we'd have them start licking pretzels. They often couldn't tolerate eating the whole pretzel. And then kind of what got them going, we would actually use like a hard candy or a gummy, like something like a Jolly Rancher. And it was just
Starburst.
a Starburst, something that was a quick energy, sugar rush, but still like a little tiny piece of it to start bringing back their blood sugar. And then over time, the nausea would start to dissipate, and they could start taking in some of the half strength sports drink, as well as starting to actually eat the pretzels. Pretzels are your best friend with these kinds of things. You don't want to give them anything greasy, although bananas are very good because they have potassium. Oftentimes people can't tolerate a banana early on in this. They can take it later, but not early on. So moving right into heat stroke, this is a true medical emergency. Please note the mortality rate here. It is 80%, and that would be if that heat stroke is not adequately treated. Unfortunately, we did see heat stroke at both marathons as well as some of the adventure races that we've covered. And fortunately, we were able to get these people treated in a very timely manner, but it's recognition. It's always being suspicious of it. This is where your heat regulatory mechanisms have failed completely. Your body temperature now is excessively elevated, and all of your organs are starting to fail because your enzymes in your body only work within a narrow range of temperatures. And when your body temperature exceeds a certain point, your organs no longer function properly. And ultimately, if heat stroke is not stopped, you will go into multiple organ failure. Now, here is where the hallmark assessment sign is a mental status change. People can have some very bizarre behavior. They will drop their blood pressure. They will get tachycardic, so heart rate shoots up. Now, their skin is usually hot and dry, but this is also super important. We all used to be taught, and I remember it in my early EMT courses, that they won't perspire. They will have stopped perspiring because they are that dehydrated. However, they can still perspire. So that was an old wives' tale. It's a myth. It is not true at all. And you don't say, oh, it's not heat stroke. The person's out there, you know, being bizarre and acting as if they have heat stroke, and they're sweating, and you're ruling it out. So
If they're perspiring and they're having a mental status change, it's heat stroke.
okay, so there's two types of heat stroke that are described in the literature. The first is known as exertional heat stroke, and that is where you have that sudden occurrence of heat stroke, and it is due to something the person is doing in that moment. It's, you know, they've been exercising, they're the firefighter, you know, in the fire. They have no acclimatization, and they're out, you know, on the football field, right?
Overdressed.
And then the next is classic, and classic is where you have an individual who may be in a situation for a long term. An example, this happened many years ago, but in France, there was a particularly hot summer, and a lot of the younger people all left like their elder parents and grandparents in their flat in Paris, and they went to their summer homes, you know, in the south of France. Well, they didn't have air conditioning because the temperatures usually didn't get that high. There were thousands of people that died, elderly people, as a result of this chronic exposure to heat and to humidity. This can also affect people who are chronically ill, and it's something to definitely be concerned about, particularly for those working in urban EMS and going into dwellings that may not have electricity, or working with people who are unsheltered, you know, the classic person who is without a home. And so again, I talked about that classic definition, and in that classic definition that we all learned, you know, from years past, anhydrosis, meaning no sweating. And again, that is not true. The classic definition has been refuted. It can delay critical treatment if that's what you're using to determine whether or not they have heat stroke. If the central nervous system assessment is abnormal, treat this as heat stroke. It's much better to treat it as heat stroke and, you know, bring the body temperature down than to miss this, because missing this is really a killer. So when you're looking at the assessment findings, ataxia is one of the first ones. Ataxia means imbalance. So the person has a very imbalanced gait. They have no coordination. They could be irritable, confused, or combative. They may not want your care. Again, that could be from a substance they've been taking, and it can be also in part due to the heat stroke or some combination. Seizures.
I had a patient with a seizure at one of our adventure races, and my initial read, I was concerned about head injury because he was seizing up on the mountain, and but he was a classic seizure patient, unresponsive. We were up on the mountain, we got him onto a gator, and at that point, I had nothing cold. All I had was literally hot bottled water that had been sitting in the back of the gator. We poured it on his clothing, we poured it on him, and that in combination with the breeze created by a Mach 3 ride down the mountain in the gator cooled him at least to the point that he was now conscious and talking to us when we got to the bottom of the mountain. And I hadn't recognized heat stroke on the scene, but in retrospect, it was heat stroke.
So if people can have hallucinations, they can syncopize, meaning they can faint, right? They'll pass out. That's why when I was talking about, heat syncope, you've got to be careful. Are these people waking right up and being normal, or are they not waking up or they're coming back and they're definitely altered in some way? Decorticate and decerebrate posturing. So decorticate posturing, as a reminder, is where you're pulling your arms inward toward your core. So decorticate core, and your legs are extended. Decerebrate is when your arms are coming out, they're right alongside of you, and the wrists are turning out. And both of those types of posturing are much more characteristic of head injury, but you can see these in heat stroke because heat stroke is literally frying the brain, and brain damage will occur if you don't cool the person down. Hemiplegia, so partial paralysis, coma is very late, and of course people can have, as I mentioned, brain injury, cerebral edema, and hemorrhage can occur. So you will actually see CAT scan changes as a result of heat stroke. And then just a little bit further on, so maybe the person is starting to come back from the heat stroke, they're in the hospital, they're not out of the woods. It's very common to have people go into kidney failure. Their organs can fail. DIC is disseminated intravascular clotting, and that's where you bleed internally. And then ARDS is acute respiratory distress syndrome, and this is where you start to have failure of the lungs, like you're not adequately oxygenating, and both can be deadly. All manner of other types of physiologic derangement. And rhabdo, you're literally dissolving your muscle, and it is literally coming out through the urine, and the urine turns bright red because it's essentially like bloody red urine.
And destroying the kidneys on the way.
Yeah, destroying the kidneys as part of that. So there's people survive this, but they can have a high risk of a lot of permanent problems as a result. So just keep that in mind. So what do you do to manage these patients?
So what can we do? In the field, first priority is always going to be rapid cooling. And historically, rapid cooling was ice packs. It was, alcohol rubs. It was anything to increase evaporation. First of all, if you can get them to a shaded area, get them to a cool place, remove clothing, put ice packs on the neck, axilla, the chest, and the groin. Most recently, the primary treatment nowadays for heat stroke in the field is cold or ice water immersion. And it took a few years for it to come out, but you were literally putting this person in a pool of cold, preferably ice water. And you'd be surprised. You'd think people would fight this. We haven't had a heat stroke patient who's argued with us sticking them in a bucket of ice water.
And yes, we've both done this.
You've got to bring the body temperature down as quickly as possible. So if you're staffing an event, have a couple of kiddie waiting pools. filled with water and ice. You want ice floating in it.
I'll come back to this.
Yeah, this is an example of what we've had at some of the marathons. What you see there are they're marathon towels, so we can soak the towels in cold water and drape the person in it.
And
But-
this was one, excuse me, that we actually used. We
Yeah.
had just treated a woman who came in, mental status change. I mean, she was literally collapsing in our arms, and we literally wrapped her head in ice in addition to soaking her body and putting, you know, the icy towels, and literally there was ice chunks floating in the wading pool.
But the key here is to cool them down quickly in the field.
Oh.
Cool them down as quickly as you can in the field. You cannot adequately cool somebody down from heat stroke in the back of an ambulance. You know, you've got your air conditioner on, you've got some cold packs, maybe some ice. You need to cool them down at the site, as long as they don't have any other cardiovascular issues that are requiring immediate transport. Cool them down on site. Fan the body after soaking them with water. You want to get the body temperature down to 101 or 102 before you stop the ice water bath. There will be some after drop. You can get some cooling below that temperature even after you take them out, so don't take them too low. But you want to get them down to a point where they're starting to mentate again. You may get them down to the point where they're starting to shiver. That's not a bad sign once they start to shiver. Nothing by mouth unless they are capable of taking fluids, just because of the aspiration risk. So they have to be mentating well, maintain their ABCs, give them oxygen if indicated. If you have paramedics on site, they can give them an IV with 0.9 normal saline. Any heat stroke requires evacuation to a hospital. This is not something you want to treat on site and let them go. They've got to go to the hospital.
Yeah, I talked about the fact that they can have a lot of organ system issues occur, right? So kidney failure and all of that. Not only do these people require hospital admission, they typically require a stay in the intensive care unit. They may come back looking pretty good, but there's a lot of damage that occurs inside when they get to this point with their body temperature. So as we showed you the marathon pools, and then
If you don't have a marathon pool available, there's always a poly tarp, you know, a canvas tarp, a poly tarp, anything. Grab a couple of volunteers, have them hold up the edges to make a container, put the person in it, any water, cold water, any ice you have, throw in there, and start soaking them down.
this was at our ski area for one of the adventure races, where we did indeed use the pool. So the current standard of care in EMS is that you don't delay immersing in ice water to await EMS arrival. Cooling does take priority over transport. The quicker you can get that body temperature down, the more you can prevent that organ damage and any type of lasting complications that can occur. So time is of the essence here. So we talk about, you know, the ice bath treatment and dropping that core body temperature. And as Larry mentioned, there can be some continued core body temperature drop. So that's why you're stopping that cooling, you know, typically around 102. The range that they have in the literature is 102.2 to 104. So you don't have that overshoot. Now, even if shivering occurs, there was a recent study looking at whether or not shivering is going to generate enough body heat that is going to be clinically raising body temperature further, and it's something to avoid. In reality, the shivering never elevated the body temperature enough to be of clinical significance. So if they do start shivering, it's a natural response to their body sort of re-equilibrating, and you know, just then keep them. You don't want, I don't want to say keep them warm because they've just had a problem with being warm, but you know, you can cover them with a sheet and you can let them start coming back to themselves, but they definitely need to be evacuated. They showed evidence of heat stroke. And then you can just sort of look at some of these other dispositions that are here.
If you, obviously, heat stroke has to be evacuated to a hospital. There's really no question there. Heat exhaustion, especially if you're dealing with an event, you don't necessarily want to treat and treat everybody, but they can stay if they're protected from the heat, if they're observed, if there's no mental status change, and the temperature stays below 39 Celsius. Heat syncope, it's usually quickly recovered from. If it's a single event, they recover quickly, cool them off, give them something to drink, have them walk around a little bit, they can stay. Heat cramps, unless there's a bad response, if they've gotten some liquid, they've gotten a little sodium, they've maybe had a little massage and it's still bad, they should be transported. If they're capable of getting up and walking out on their own, they can probably be, streeted. But heat stroke is yeah, they have to go.
Yeah, absolutely. And the one caveat with heat syncope is, again, keep in mind other potential causes of someone passing out, right? So if they're elderly, I mean, there's a lot of folks in church. This is always, where it's a hot day, maybe the air conditioner in the church isn't working well, or there's a lot of people and it gets warm in there, and you have the elderly person go to ground. And but then that person also has, cardiac history and all of that. I'm going to err on the side of caution, right? So I'm going, if I'm the one who's there as a bystander, I want this person transported. And if I'm on the ambulance, I'm going to absolutely try to talk this person into actually going, with the ambulance to be evaluated in the emergency department. So prevention. So this is important. You want to always make sure that you have adequate fluids and electrolyte containing foods. So, again, sports drinks, eating lunch, and you've got a variety of things. You got some
Normal diet.
normal diet, yeah. Peanut butter and of course we won't talk about what I eat.
But just a normal
normal
diet,
diet.
a normal diet typically contains enough food as long as they're not overstressing themselves. But it's maintaining fluids and electrolyte containing foods. You want to keep people moving, especially if they're standing still. Keep them moving, keep moving around. Let the muscle pump keep the blood flowing. Limit sun exposure. Use sunscreen. Sunscreen by itself may not do much for the heat itself, but it's going to prevent the sunburn, which can then contribute to heat problems. Plenty of rest breaks, especially in high temperature, high humidity, and early in the season. Lots of rest breaks. People need a place where it's shady, where there's a fan, where they can cool off periodically during strenuous activity. Lightweight clothing, light colored clothing, loose fitting, let the air promote evaporation and convective cooling. In strenuous activity, or especially like construction work, things like that, consider ice vests or cooling neck bandanas. Some of them are crystals, which hydrate and then just promote evaporation. Some of them are literally ice vests, where you pack them full of ice and they cool off over time in extremely hot conditions. Promote acclimating to heat during the early season. Don't just jump into your first marathon in the middle of July. It's bad news. You want to acclimate and train up to it in the season, and know your own limits. Some people know, I just can't do heat, either because of medical problems or medications they're taking. They can't do heat. Know your limits and follow them.
Okay. So
Just for time.
just for time, we're looking at 10 of 8. Before we move into cold injuries, is there anyone who has a question? I will.
I had a
Please.
quick question regarding heat injuries. Any considerations when I know some of us like work at resorts and whatnot, when people are like using the sauna for extended periods of time, is that lend itself? I know there's a lot going on there, but I mean, like people that are acclimatized to like a longer stay versus like people that are in there and just get all wigged out.
Yeah, so also it depends on what you've consumed before going in there, right? So someone who's had a nice glass of Cabernet, or other
Or a
alcohol,
couple.
or a couple, then they go in, or again, they have no heat acclimatizations. Same rules apply with a sauna. It's humid, it's hot, and people with cardiac conditions are often warned sometimes to be very, very careful or not go in, right, to avoid saunas altogether. So
There's
yeah.
most saunas and even hot tubs will have warning signs against if you have medical issues, if you have cardiac issues, if you have pregnancy, and avoid alcohol in the hot tub or sauna.
One of the things I didn't mention, if you're doing a coverage of an event, and both Ski Patrol and EMS, they will do these coverages, and it's a great way to bring in some funds, into your organization. If there is a vehicle, a large vehicle, some of the EMS agencies have a large like command vehicle that is air conditioned. They are great for sort of recovery of people who are really, really hot. And we would use those in our marathons where literally, people could go in, the air conditioner was on full blast, and it just allowed people, whether they were the bystanders or they were the athletes, just to come back to themselves. So something to think about in your planning for events. Any other questions related to heat? Okay, moving right into,
Well,
Oh.
Linda, let's give everybody a 5 minute break.
Okay.
Go to the bathroom, and then we're good with time, and then so after 5 minutes, let's jump right back in.
Got it.
All right.
Oh, there's Judy. You know what? Just go ahead and hang that up. And Judy, I'm sorry. Hi. This Judy, you have you're muted if you're saying something.
Okay, there I am.
Hi there. Sorry, we're having a little challenge with a telephone. We were trying to take off the hook. It normally stops beeping, but it was beeping at us and making us crazy.
Okay, great presentation. Thank you, guys. I came on a little late, and so I didn't pre-register. So I'm having difficulty trying to figure out how to do that.
Don't worry, Judy, I wrote you down on here. So
Oh, you did it for me?
yeah, if you could put in the chat your email and date of birth and your certification number, I'll add that to my roster.
But I looked for that, and I don't know what I'm looking for, because I went to chat, and all it says is that you were sent a message after it started, and it just allows me to reply to a message, but it doesn't allow me to put any information in.
In this chat with Zoom.
Yes,
Okay.
that's why I'm doing this now. It's like I don't know the place I'm supposed to put that number and that information. I can't find.
Okay. Well, if you don't mind just telling me right now
Sure.
your start number.
048593.
048953.
Nope. 048593.
593.
Yes.
And if you don't mind your date of birth.
060452.
Perfect. I will make sure to add that in.
Thank you so much. I appreciate the help.
Not a problem. That's why I'm in the background.
Okay. Bye. Thanks for doing this. Did you put it together?
Yes.
Did he put it together?
Well,
Or did you-
Larry and I put this talk together, but
Eric started it all.
started it all.
Okay. I was going to say I've never done one with Effie as the platform. So I thought that was kind of cool that it's a platform I haven't used before.
Yeah. Well, gotta
Okay.
try something new, right?
Yep, love it. Thank you.
Alright.
Okay.
We'll start back up in about a minute or so. Uh, I'm just checking, see if anybody else logged on. Uh, is the person whose name on here WSB, are they on? Can you say hi? Alright. What about Nancy? RDV? WSB, I don't know your name. I need to do it for registration. If you, Wolfgang, perfect, thank you. That makes sense.
Is Chuck on right now?
Um, that's what I'm looking.
There was a comment in the chat about using mustard packets.
That's a new one to me.
Yeah, Larry, a couple of the adventure events I've run, the athletes are carrying them, like instead of, the goo shots and everything like that. The thought being they're high electrolytes and apparently they're loving them for cramp avoidance or something. So,
I mean, it's certainly possible if it works for them. They typically have a lot of salt in them and, other electrolytes. The other one I've seen, and kind of, sort of an emergency for your first aid kit, I've seen people carry soy sauce packets from your Chinese restaurant because they're heavily salted, and they hold up better in your first aid kit than those little paper packets of salt that you get at the fast food restaurant. So, I mean, if some people like, the mustard packs, the other thing that people have been using is, any marathon or adventure race, they always had Philadelphia soft pretzels and bananas, but now it's pickle juice. A lot of people, recovering with pickle juice or starting the race with pickle juice just because it's a lot of salt, liquid, refreshing. A lot of people finding things that work for them,
Mhm.
but mustard is had not heard about.
We've used pickle juice for a long time. My name's Jim Keeley, and I have 27 years in the military, and I was stationed in the desert for 7 years, and we used pickle juice for recovery for after a PT test, after a 12-mile road march, and all other kinds of events. Like I remember one day we had a change of command ceremony when General Wesley Clark took over the National Training Center, and we had soldiers falling out, and I was a combat lifesaver back then, and we used pickle juice to help them on the way to the hospital to help start the recovery process.
That's
Yeah.
awesome. That's
Fantastic.
awesome. Thanks, James.
Yeah,
Wow.
no problem.
I know people who swear by pickle juice at marathons.
I love drinking it anyway, so I drink it all the time. But yeah, it really also it really also helps for cramping. Like
Yeah.
if you severely cramp, pickle juice is amazing. It's better than eating a banana for the potassium. And pickle juice is just it's just such an amazing medicinal thing that's a side effect of making the pickles that everybody enjoys.
Yeah.
Absolutely.
Most everybody.
All right, what do you think, Eric? Are we ready to go?
Yeah, I would say so. Just to make sure everybody is coming back, if you guys could in the comments just put something that you liked so far. And then once the comments start going, Linda and Larry, you guys can start.
Okay.
Okay, all right.
Comments.
All right. Great. So, we're
Where's the
gonna,
comments? I'm sorry. I'm not seeing the comments. I'm seeing everything else, but is it the chat section?
Yes, the chat, I'm sorry.
Okay, no problem. Listen, you're talking to a knuckleheader here, remember? All right, thank you, Eric.
no worries, technology. So we're gonna get right into hypothermia. And we'll start, by talking about the different levels.
For those of us that are ski patrollers, something near and dear to our heart.
Yeah, and I'll just point out that the pictures that you see are ones that I took last season. And so you can see that there are people who are quite inadequately dressed here. This was toward the end of the season, but I still think it was a little bit nippy to be like wearing a bathing suit when you're out on the hill. So in any event, hypothermia. So we're going to start out with just some general definitions. It's anytime your core body temperature is less than 35 degrees centigrade or 95 degrees Fahrenheit. And we all who practice in a winter environment know those things that can make it worse, right? So the weather, person being poorly insulated, like these individuals in the bikinis, inadequate shelter, poor nutrition, illness, if they take any type of vasodilator, it could be a blood pressure medication or it could be alcohol from the bar, right? Then all those same mechanisms of heat loss apply. So they lay on the snow, conduction occurs. The wind blows, convection cools them down further through wind chill. They evaporate, right? Any moisture on their body is going to increase that cooling effect. They radiate the heat that is being generated by their body naturally, and they respire where they're breathing in cold air and they're exhaling the warm air that comes from, again, their metabolic processes in their body. So we can use those to kind of think about how we're going to recognize but also prevent hypothermia. This was also one of the characters who was out
At our annual pond skim at the end of the season.
So yeah, standing on the back patio, back deck of the patrol building, snapping some photos. I figure he's probably not one that you can recognize unless you know this guy. Anyway, so the weather, the main risk factor is an environmental temperature. Believe it or not, less than 82 degrees Fahrenheit. A lot of folks seem to think that in order to get hypothermic, you start needing really cold temperatures or, less than freezing body temperature or less than freezing outdoor temperatures. Not true. Particularly when you're talking about anyone who is injured. If you have anyone who, let's just, think about the typical injured person or even ill person. You do what we do in the emergency department. You strip them naked, you put them on a stretcher, right? And you don't cover them up. If that room temperature is less than 82, they will get hypothermic because they're not moving. So it doesn't really take a cold temperature to do this. Wind chill, again, higher the wind velocity, the rate of loss increases, and wet conditions. And we know that, people come out, they get wet from laying in the snow, not being adequately clothed.
This is just an example of some winter camping we did down in Shenandoah, Virginia years ago. So given this picture, think about some of the methods of heat loss that we're trying to prevent here. So you've got shelter. So hopefully in the tent, we're cutting down the wind. If we're zipped up in the shelter, our body heat, our respiration is going to increase the temperature inside the tent, which will hopefully slow down cooling of the body. If the tent is insulated on the bottom, we're protecting our butt from sitting on cold snow, so we're minimizing conduction. So just an idea of protection out in the woods that, if you're dealing with the environment, it translates to if you're just out in the environment, if you're riding the ambulance, how you dress differs when it's July and when it's January, and what you need to do to protect yourself in that environment. out here, we're drinking hot liquids, hot coffee, hot tea, hot chocolate. We've got a stove, we're eating hot food, putting in calories, trying to maintain our body temperature.
And that is not Larry, by the way. That's a friend of ours who, we,
Larry's taking the photo.
yeah, we conned into coming on a winter camping trip where the temperature got 8 degrees below zero. It was great.
The last trip he went with us.
So, thinking about, again, the person who's injured, person who's in shock, what happens in initial trauma? Your metabolic response to injury will actually reduce your metabolic rate, right? So when you think about blood loss, for example, the normal things that occur when you go into shock, the blood that is in the periphery of your body, your arms, your legs, it is shunting back toward the core. So in classic hemorrhagic or hypovolemic shock, you get the cold, clammy extremities, and you have that blood returning to preserve the critical functions of your heart, your lungs, your brain, right, to maintain life. Well, in that metabolic rate decreasing and the decrease in body temperature, since you don't have that nice warmth of your upper and your lower extremities because blood is shunting, it actually promotes greater degrees of hypothermia. So you don't have adequate heat production, you can't maintain normothermia. And if you just take trauma patients in general, anyone who is hypothermic has a higher risk of ICU admission, blood transfusion, we'll talk about that in a moment, and also trauma mortality, so increased risk of death. Now, the blood transfusion piece, here's why this is important. Just like other organs in your body, blood clotting itself is temperature dependent. Blood only clots according to a narrow range of temperatures. And if those temperatures are exceeded in either direction, blood will stop clotting. And so you will actually have a patient who is bleeding bleed more when they are hypothermic. So, and of course, I just talked about this. So in that problem with blood clotting, your platelets do not aggregate, meaning normally to form a clot, you're clumping your platelets together, that clumping's impaired. Huge term, thrombocytopenia. It means a low platelet count. What's happening is, as everything is being shunted, your platelets actually like to stay in your liver, right? And your spleen. It's like, it's warm in here, we're not coming out, right? So your platelets literally don't come out, and you don't get that clumping effect to clot off an actively bleeding vessel. So you will have the prolonged bleeding times, and you will have increased hemorrhage, and certainly
the real takeaway is for as ski patrollers out on the hill, or whether you're taking somebody out of a wrecked car on the side of the highway, cold patients bleed. And just keep that in mind. So the tendency is, we're doing our examination, we open their clothing, we take the blanket off, put it back, keep them warm as soon as you're done your whatever activity, and keep them as warm as possible.
So anytime we immobilize in any way, whether it's on a backboard, again, in the back of an ambulance, to putting them on a backboard and then taking them down the slope in a transport toboggan, you will actually reduce their ability to generate heat right through movement. So immobilization makes that worse. There is a situation where you actually get hypothermia in urban settings as well. And you would think, well, why don't you just go in from out of the cold? But urban hypothermia can occur in a few different conditions in again, that extreme of age. So the very young or the very old, people who take certain kinds of medications, just like with heat illness. So people who take sedatives, anti-anxiety agents, phenothiazines or tricyclic antidepressants. These are medications that are often used to treat people who have mental health disorders. And these types of medications can definitely predispose to heat or to cold illness, because it will decrease your metabolic rate. In many cases, it sort of slows the person down, and they can't generate their body heat. Other diseases besides the behavioral health problems, hypothyroidism, stroke, and spinal cord injury. Forever and for always, people with spinal cord injuries take on the temperature of their environment. They are just like reptiles. They are poikilothermic, so they will either get dangerously cold in the wintertime or when temperatures are below 82 degrees Fahrenheit, or dangerously hot in high heat conditions. Anyone who's intoxicated, malnourished, or again, is in poverty and has inadequate shelter. And speaking of immersion hypothermia, which of course occurs if you fall into, thin ice or are stuck in a you're drowning in a pond in the wintertime or even heck, it may not be winter, but the cold water is actually lowering your body temperature. Immersion hypothermia can develop very, very rapidly. Your water, as you can see, is conducting that heat from your body 25 times faster than cold air. So it will lower your body temperature very, very quickly. And we've got a great video that we want to show you on this, and it is very informative. So looking at these pictures.
Are these guys at hypothermia risk? Again, this is back from our pond skim. It was actually a pretty nice day, but that water was cold. That was the pond skim is filled with pond water from the melting snow coming off the mountain. So it was probably running about 35 to 40 degrees. So the people that we were fishing out of the pond skim are freezing, having been in the water for 15 seconds. So just keep it in mind that, it's being aware of the environment and the conditions that you might be encountering when you're rescuing these people.
So there's a couple of different concepts that are important when we are thinking about submersion hypothermia. Okay, so this is the classic cold water drowning. And I think most of us have been taught that there may be a survival advantage in submersion hypothermia where, if you drown in really cold water, you have a much better chance of being rescued and hopefully successfully resuscitated. Well, there's a caveat to this, and that is, when did the hypothermia and the hypoxia occur, and kind of in what order? So if hypoxia occurred before hypothermia, that person does not have any advantage in a cold water drowning, because the anoxic injury or hypoxic injury to their brain has already occurred. However, if the person goes into cold water and their body temperature drops and the hypoxia or anoxia even occurs later, then they actually do have a better chance at a successful resuscitation outcome. The hypothermia before the hypoxia does offer some protection of the brain. There are many, many studies in the literature looking at the amount of time that people were able to actually survive resuscitation efforts and then actually come back and have intact survival. The longest so far in the literature is 66 minutes. It was actually a female physician, and I believe she was in Norway. And she was on a trip where she cross-country skiing, and she fell through thin ice. And by the time they got her out, they did 66 minutes of CPR, and she survived. And we were talking about it this morning, that her initial goal was to be a neurosurgeon. However,
she had some apparent, just a little bit of deficit after her recovery, so she went into anesthesiology, I believe. So I apologize to any anesthesiologists in the group, but
so yeah, but she did survive, and she went on to practice as a physician. Yes, so it is something to, you may work these people a lot longer, right? And you don't know, like, does the person have hypoxia before hypothermia or vice versa? But if the person doesn't survive that, it may have been that the hypoxia preceded the hypothermia. So the classifications, there's mild, moderate, and severe. You can see the temperature ranges here. Really, to get an accurate temperature, the temperatures need to be core temperatures. And we're not generally doing core temperatures. You can take a temp in the aid room or in the back of an ambulance. Realize that your oral temp is probably going to be very much inaccurate. However, it may give you at least a sense of where they're going. If they're hypothermic in an oral thermometer, you know they're hypothermic, and they're probably more hypothermic than that. That's about all that we can probably tell you.
And if you're not able to take a rectal temperature, you're probably going to be relying more on the patient presentation.
Yeah. And so early on, if you're measuring vital signs, when that person is just getting into the mild hypothermia, it's actually more of a fight or flight response. The person's getting cold. They get tachycardic, their respiratory rate goes up and their metabolic rate goes up, trying to generate heat to compensate. However, as hypothermia continues to progress, that's where you're now getting bradycardia, your respiratory rate slows down and the cardiac output drops, your blood pressure falls, and you start getting dysrhythmias occur, cardiac dysrhythmias, and then finally asystole, or no heartbeat at all. So that is in the moderate to severe range of hypothermia when you start to go from that early, where you have the increase, to the late, where now you have the decrease. So focusing on mild
hypothermia, you're running 32 centigrade to 35 centigrade, so 89, 90 degrees to 95 degrees Fahrenheit. The skin is pale and cold. The people are mentating okay. In most cases, they're shivering. They get the umbles. And remember the umbles. They stumble, they mumble, they fumble, and they grumble. So they may be ataxic. They're not walking well. They may be stumbling. They're not talking well. You're asking them questions. They're slurring their speech. They're mumbling. They can't fumble. They can't zip up their jacket. They can't button their sweater. And they're grumbling. They're just kind of muttering to themselves.
They're miserable.
They're miserable. They're uncomfortable. They're unhappy. They're first day skiers. They're ataxic. They have poor coordination. They may be confused. They're tachycardic, hypertensive. They're breathing rapidly, and they want to pee. They want to pee a lot. They've got cold diuresis. They may have already peed themselves, depending on what stage they're in. And this contributes to dehydration. And as we talk a little bit more, one of the things you want to maintain in a cold environment, and it's very often overlooked because you tend not to be thirsty, is you need to maintain good hydration to maintain body temperature. In mild hypothermia, if you've got somebody with it, prevent further heat loss. Get them out of the elements. At the ski area, it's get them into the lodge, into the aid room, get them out of the elements. On the street, get them into the back of your ambulance. If you have a choice between treating them on the side of the road or getting them in the back of your truck, get them in the truck.
Crank up the heat.
Crank up the heat. Remove wet clothing. Remove wet clothing. Get them in.
Sorry.
Get them in dry clothing. Wrap them in dry blankets. If you're backcountry, you're getting them out of wet clothing, and everybody else in the party is contributing whatever dry clothing you have. Wrap them in dry blankets. Make sure you cover the head and neck. You lose a lot of heat through above your shoulders. If you can't transport, or if no transport's indicated because you're able to warm them, make sure they get in dry, warm clothing. Wet clothing, particularly cotton kills. Wet cotton clothing promotes heat loss because the cotton fibers absorb the water, the patient stays wet. Synthetic fabrics and wool, the fibers do not absorb the water. So once the body heat evaporates the water in the clothing, the clothing is relatively insulating, but cotton kills. Get them in warm, dry clothing. give them warm, sweetened beverages if they're capable of taking beverages without aspirating, and encourage a little bit of exercise just to generate some heat.
So in moderate hypothermia, now we're really transitioning into a much more dangerous phase. And you can see the body temperature here. So in Fahrenheit, since you're probably mostly working in Fahrenheit, 82.4 to 89.6. Keeping in mind the normal body temperature is about 98.6. So we're pretty low here. And here's where we're now into low blood pressure, hypotension, bradycardia, bradypnea, which is just slow respiratory rate. So shivering actually will stop. Shivering is actually one of those processes that requires glucose, right? It requires calories. And when you stop being able to use calories, shivering actually stops. And you're not generating heat any longer. So your level of consciousness falls, your speech becomes slurred, and your pupils dilate, and you start to look more on the dead side than alive. These people get very rigid, they stumble, they fall. And there's this really strange thing that happens called paradoxical undressing. And that's why I have this pile of clothing on the snow here. But in this paradoxical undressing, they're taking off their clothes. It would seem like, hey, why would they do that? They're cold. But they get this sensation of warmth at the sort of terminal end of this moderate hypothermia, where they have a rush of blood coming to the skin, and they feel warm, and your perception of temperature is related to the sensation of warmth on your skin. And when that blood rushes there, that's what causes them to disrobe.
If you do search and rescue, very often in winter environments, that's how you find your patient ultimately, is finding the trail of clothing.
These are also the stages where cardiac dysrhythmias occur, right? So that gentle handling becomes very, very important. So if you handle them roughly, they can go into ventricular dysrhythmias and now go into ventricular fibrillation, and now you're doing a resuscitation, right? So you're preventing further heat loss. And this is where both external and core rewarming are important. Now, again, in the past, there used to be advice, do not apply any external active rewarming to anybody who's cold. The most recent research on this issue is that, yes, you warm the extremities and you warm the core, and that will, again, prevent further loss. And it's not going to cause enough of a problem that somehow that cold blood coming back to the core is going to put the person into, cardiac arrest. That was always the concern. It was more theoretical. Most of the sources that I'm reading now on this, in the EMS world and in the trauma world, is go ahead and warm them. So you want a pre-warmed ambulance. If you have heating blankets available and a vapor barrier, meaning like something like a tarp over top, just to keep all the heat in.
If you have oxygen, try to pre-warm it.
The idea of the core temperature after drop. So, you move them in from the cold, and they will have colder extremities than the core. So when that blood does circulate, and of course the blood is always circulating, right? When it comes back into the core, you can actually drop your temperature a little more before it will start to go up. These people do need to go to the hospital very, very quickly for extracorporeal core rewarming, meaning there are some devices like cardiopulmonary bypass, and I'll talk a little bit about that, and ECMO, that the blood is put through a circuit that warms the blood and it pumps it back into the patient, and that's how the patient is reheated over some time. So for people who may be paramedics, if they are getting any drug therapy, you're only giving essential drugs, you're avoiding any non-essential drug administration, because what happens is, as the patient warms, that drug metabolism can be very unpredictable, and those drugs could have started accumulating, and all of a sudden they kick in, and now you have a toxic effect of those medications. So severe hypothermia, I couldn't resist, like this picture with Santa Claus laying on the ground. You have severe muscular rigidity, and you've got altered mental status and coma. Very bradycardic heart rates. So you may not even be able to detect a pulse. In fact, you think the person has no pulse, but it's very, very slow.
When you're taking a pulse on somebody in hypothermia, you may be taking a pulse for at least a full minute to determine whether they have a pulse or not.
These folks may not be breathing, they may have non-reactive pupils, may have no discernible blood pressure, and they may have life-threatening dysrhythmias, and they may be in cardiac arrest, and they may look dead. Okay, but we know that no one is dead until they're warm and dead, right? And this may mimic death, so we have to presume that we can rewarm them, and hopefully in the hospital setting, with some of the warming methods that are available in the hospital, they may be successfully resuscitated. So they need to be handled extremely gently. And as I mentioned just a minute or two ago, the extracorporeal rewarming, meaning outside of the body rewarming, that's what the meaning of extracorporeal means, using either classic cardiopulmonary bypass, like what is used in bypass surgery for the heart, or ECMO, extracorporeal membrane oxygenation, which is another circuit that blood goes through. The temperature can be set to rewarm the blood and then take it back into the patient. And these devices will raise body temperature over time, and then the patient can be managed. So if you detect some faint pulses, the advice is actually to avoid CPR, because you may be doing CPR on a person with a heartbeat, which can precipitate dysrhythmias. And these people need to be evacuated as soon as possible while they're being continuously monitored. So there have been multiple case reports of intact survival, and you just have to use your clinical judgment here in these cases. Okay. I'm going to move right into, I want to have time for the videos.
Yeah.
So I'm kind of moving along a little bit quickly here. So frostbite. So the important thing to know about frostbite is that it is actual frost formation, ice formation within the tissues of the body. And that ice, that crystal, will actually stimulate an entire inflammatory cascade, which is what is responsible for the damage to the tissue that occurs in frostbite. So for risk,
Increased risks are inadequate or wet clothing, fatigue, poor nutrition, smoking, alcohol, drug use, impaired circulation. Do you detect a commonality between all of these environmental effects? The same risk factors apply. If you're not eating well, if you're drinking too much, if you're soaking wet, not wearing the proper clothing, if you've got underlying medical conditions, all of these, whether it's heat or cold, can precipitate these problems. It usually occurs in the extremities, higher incidence in the feet than the hands. But, obviously, if you wait long enough, you will get frostbite of the ears, the nose, feet, hands, arms, legs, if it progresses long enough. One thing to consider, and it's a challenge in the field, is we'll talk about different levels of frostbite. When we see them in the field, they all pretty much look alike. The pictures that you're going to see are days to weeks after typically the thawing process.
So in terms of different types of frostbite, the most superficial is frost nip. And that's not really a form of frostbite. However, it can progress. So it is included in the range of types of frostbite. And it's easily treated by putting your direct heat right on the like say your nose, for example, frost nip nose or cheeks.
Hands in the pockets.
Yeah. And it resolves pretty quickly. However, you can have frostbite that can range from partial to full thickness, just like with burns, first through fourth degree. And in these cases, now you have cellular ischemia, or lack of effective blood flow to these areas, and those areas are getting hypoxic, to full out necrosis. And we will show you some pictures of what that looks like. So in first degree frostbite, here you have a extremity. Remember, Larry said it all looks the same in the beginning. Pale, white, and numb while frozen. However, the picture that you're looking at that looks very red is after rewarming. And what happens is edemia and hyperemia, meaning you've got a lot of, blood vessel dilation, and you get this type of appearance as the rewarming continues. And the feet will get very swollen, even in first degree frostbite. In second degree frostbite, you will see pale white and numb while frozen. Again, same as with first degree. But after rewarming, there will be a period of redness, and you can see some of the redness starting. It will get worse as these fingers are starting to kind of come back. However, in second degree, it is characterized by clear fluid in the blisters. And you can see those here. In third degree, which is pretty dramatic, again, in the early phases, pale, white, numb. They all look pale, white, and numb. And then you're starting to get the pain, the redness, the edema with rewarming. And in third degree, you've got these dark blisters. They contain hemorrhagic fluid. And the skin is red or blue, and it may not blanch, meaning when you press on it, it doesn't return to the normal color, right? And you can have a combination of second and third degree, because I see some fluid-filled, clear fluid in these blisters, and I see some dark fluid. So just like with a regular thermal burn from fire, a hot surface, you can have the same kind of thing
You seldom have 1 degree of frostbite. You have a variation
in any one given extremity. So fourth degree, you're now down to tendon and bone, right? Muscles, tendon, bone. And again, in the beginning, it all looks the same, pale, white, numb while frozen, and a chunk of wood consistency. And that is really important. Imagine that hunk of meat you find in the deep freezer in the grocery store. That's how it feels if you were to touch it. And then as it starts to rewarm, you will get the bluish discoloration, and you get these later as this evolves, the deep dry black crusted lesion, and you can get gangrene. Now, it can take weeks for frostbite to fully evolve, and that is super important to know. So the tissue viability is not going to be known for a long time. And in fact, what can happen here in some of these gangrene cases is the body can auto amputate, and you will find like toes in the bed. And when I was working in Maryland at the shock trauma unit, I found toes in the bed before with frostbitten extremities. So how do you manage it?
frostbite management. If you suspect frostbite and you're transporting somebody, splint to minimize motion, pad between the toes and fingers, as the picture shows, elevate the extremity. This is very important. You do not allow the part to refreeze once it's frozen. If you happen to be, in the case of, you're hiking in the backcountry, you're cross-country skiing, you're out for a few days and somebody gets frostbite, if they have to hike out or ski out on their own, do not allow the part to thaw. Because if the part thaws and refreezes, the damage will be much greater than if you leave it frozen, let them evacuate on their own. And then what it boils down to is, if you thaw it in the backcountry, you will be carrying your patient out trying to keep their feet or hands warm. Now, for people in urban EMS, this is a case, the bottom picture is a case. This is something you might see in urban EMS. This is perhaps your homeless patient or your chronic patient. They may have a place to live, but it's cold. If they have gotten frostbite several days before or a week before, and now you're coming to transport them, this is where you might see frostbite that doesn't look like the classic, white, pale. They have started to present and rewarm and present with the later frostbite symptoms. if you've got a frostbite patient, you have to assess for and manage hypothermia. Just assume they have hypothermia until it's proven otherwise.
So now, as far as the rest of the management, so in terms of what you do, I'm adding some medications here, and I'm giving you this information in case like you're stuck out and you wanted to know how to take care of yourself. So part of the protocol for hypothermia management is ibuprofen, 400 milligrams. So Motrin, right? Over the counter Motrin. This is actually part of the treatment protocol. Giving Motrin will actually inhibit the inflammatory cascade, and it can improve outcomes in frostbite. So 400 is given before thawing, and then ibuprofen, 400 milligrams 3 times per day. And just kind of keep that in mind for yourselves. I'm not advocating that we do that without medical control, right?
This is not
For our
something you're
ski
doing
patrols.
in the ski patrol first aid room or in the back of the ambulance.
At this point in time, unless, protocols change in some way. But just so you know. So pain management. So frostbite thawing is an extremely painful process. And usually these patients require high degrees of opioids. And how they are thawed is the extremities are rewarmed rapidly in a water bath. Here's another thing that has changed in the literature. It used to be that the temperatures of the water bath were recommended to be higher. It used to be between like 104 and 108 degrees Fahrenheit. Well, now we're down to 98.6 Fahrenheit to 102 degrees Fahrenheit because they found that water temperatures greater than 102.2 are much more likely to cause damage. At the same time, if you rewarm too slowly, like you don't rewarm in a water bath, that actually can increase inflammatory damage and more secondary damage. Anything that is going to feel uncomfortable to you as the rescuer when you're putting your hand in is too warm, and it can increase injury of that frostbitten part. So do keep that in mind. That would be like if you had to estimate and you didn't have a thermometer to test the water temperature. Once they're in the hospital, and we used to see frostbite quite often, unfortunately, in the wintertime, again, mostly people who lacked adequate shelter. It's all about pain management. The pain is severe. This is a tetanus-prone wound. These people need tetanus immunization. And then what happens in the hospital, what should happen, is a bone scan. And there is a new drug, it's called iloprost. It's actually new to the United States, but it is not new to Europe or other parts of the world. Iloprost is a vasodilator, and it also will decrease the inflammatory cascade. And it has been found to increase the viability of fingers and toes that have been severely frostbitten. It has offered hope instead of having these auto amputate or requiring amputation surgically later. So some reminders: don't use dry heat to rewarm. Do not thaw if the part can refreeze, as Larry said. Don't rub or massage the area when frozen. Don't rub the frostbitten area with snow. And if evacuation will be delayed, don't rewarm if there's going to be a risk of refreezing, right? It's better to have the person walk out. And so here's just some field care using some sleeping bags and a tarp.
Commonly referred to as like a hypothermia wrap or a hypothermia burrito. It's applicable if you're in an ambulance or, in anywhere in the backcountry. A tarp, insulating layers like foam pads, blankets, sleeping bags. You're basically putting the patient in the middle and wrapping them up as a burrito. To keep body heat in if you have no other means of heating them, but also to protect them from the elements if you have to transport them in a search and rescue type of environment.
Okay, this is really what I wanted to get to. So two situations: a sinking car, and also if you fall through the ice. And I'm going to actually play a couple of YouTube videos. We saw these videos when we were attending a wilderness medicine conference, and Dr. Gordon Geisbrecht, they call him Dr. Popsicle because he's a cold injury researcher. and he's fascinating. So I'm hoping this is going to work.
For those of you, before she starts this, for those of you that remember the old, if you're stuck in a sinking car, you wait for it to sink to the bottom, and then when the water fills up, then you can open the door. You're going to die.
Mhm.
If the car goes in the water, as soon as it hits the water, open the window, take off your seatbelt, get any kids or pets out of the car, and get out. Do not wait.
It's a good idea to have a center punch that also has a seatbelt cutter in your car that you can grab in the event that you can't get your seatbelt undone, or you need to actually break out glass and self-rescue. But I think this is going to be very interesting for you. So,
I think you're gonna to
Scenic gravel pit on the
minimize.
outskirts of Winnipeg, Manitoba. In the hallowed halls of Canadian academia, there is one scientist who has dedicated his considerable talents to solving that most Canadian problem. What to do if you find yourself behind the wheel of a car that just happens to be underwater. Gordon Giesbrecht. You may
We
remember
don't see the picture.
as Dr. Popsicle. This week, I join the good doctor and do my part for humanity by signing on to become a dunk test dummy.
wait a minute. All right, let me go back. Zoom. All right, I've got to do a different screen share, apparently. Let me figure this one out. Go. Let me actually pull up the video first, then I'm going to go back in and try to see if I can't share it.
Linda, if it's easier, put the link into the chat and I can bring it up from my end.
Okay, all right, I'm going to do that then. Because yeah, there's two here. Let me just end the show for a second. Yeah, it will be easier. Right. Okay, here's the first one. All right. And did you get that, Eric?
I'll tell you in 1 second. Bring it up. You put in the chat
You did.
to everybody.
Well, I think I did it to no, I think I did.
Looks like
Oh,
it.
it went to Chuck.
All right, I don't see it yet.
No, I've got it. Hang on. Meeting group
Meeting
chat.
group chat.
Okay, here we go.
Sorry, I'd stream it if I could, but I'm driving.
All right, I got it. Hold on. Do 1 second here.
Set up to send.
Yeah.
You actually have to paste the link. Oh, there it is. Never mind. I got it. All right. Give 1 second.
Sure.
This video is kind of really good. One thing that we've seen over the past few years is a number of those tragic stories about people drowning in cars that drove into water, where you have, 4 high school kids who are all on the phone with all on their own phones with 911, sitting in a car sinking, telling them they're trapped in a car, and nobody thinks to get out of the car. And this is one case where you don't call 911, you just get out.
You ready?
Okay, is there volume?
Welcome to scenic gravel pit on the outskirts of Winnipeg, Manitoba. In the hallowed halls of Canadian academia, there is one scientist who has dedicated his considerable talents to solving that most Canadian problem. What to do if you find yourself behind the wheel of a car that just happens to be underwater. Gordon Giesbrecht. You may remember him as Dr. Popsicle. This week, I join the good doctor and do my part for humanity by signing on to become a dunk test dummy. Dr. Giesbrecht joins me now. Hello, doctor. How are you?
Good morning. How are you, Rick?
Very good. Good to see you again.
It is great to have you back.
Kind of good to see you again. Of course, for those of you who may not remember, we met the good doctor a couple of years ago
Yep.
at the University of Manitoba. I went there. You were doing work at the time, how to deal with hypothermia, what to do if you fall through the ice, which Canadians are wont to do sometimes.
Yeah.
And you intentionally freeze people, basically.
Yeah. You can quickly get to some.
I think my penis is actually inverted.
Yeah, I've had shrinkage before, but I think this is gone beyond shrinkage.
Now, we're obviously not studying hypothermia now because it's, well, how warm is it here today? Or shall I say how cold?
Well, I haven't measured the water temperature. It is cool, but this is not about cold water. It's about what happens if your vehicle ends up in water.
That's what we're doing here today. Doctor, what do we have here?
Well, this is the car that we're gonna break the windows in.
Yes, we are.
No, not yet.
No?
We want people to open the windows to get out.
Yes.
If you have manual windows, those will work pretty well.
No one has manual windows.
Right. Electric windows might work for a few seconds. If you don't do it quick enough, they'll short out and they won't work.
Right.
But still, your best way is out a window. You know, everybody thinks it's pretty easy to kick a window open, so why don't you give it a shot?
Okay.
Have a tantrum on it. There you go.
So that would be failure.
Well, everybody thinks you can kick it, but there is a much easier way. The center punch,
Center punch.
and all you do is push it against the window, like that.
Yeah.
And as you can see, it works very well.
Where can you buy these?
You can buy them at any safety store.
That is awesome.
There is a way to kick the window if you have to, and that is to kick it near the front where the hinges are.
I kicked here. Are we gonna take this car in the water?
I have another car for you.
Two cars. It's a good week. So we're really doing this.
We're absolutely.
It feels like we're stealing it. You know, I'm still not entirely clear what we're doing. I need an instruction.
Seatbelts, windows, children, out. As soon as we hit the water, get your seatbelt off, get your window open, because that's how you're gonna get out of this vehicle.
Forget about the door.
Very difficult to open if not.
Because people don't think of the window as a place to exit the car.
No, you get in,
Unless you grew up on the Dukes of Hazzard. Seatbelts, windows, children,
out.
out. That was it. I knew it, forgot one. Out.
This car is going to sink
Right. But we're gonna get out the way you're supposed to get out.
before it sinks.
Because we're saying, what are those words again? Caution,
No.
protection, stop, drop, roll. Okay, windows up. That looks like a lake, but the GPS says it's a roll. Oh my, oh look. Oh. Oh. Okay, we're in the water. Okay, seatbelts up. Seatbelt up. Yes. Seatbelt. Get on the phone. Windows up now.
Off the phone.
Okay, yeah.
Windows.
Yeah, yeah. Well, okay, just get out. Just get out. Like this. Huh.
Well, you had to get down.
You don't have a lot of time before that car starts to go under, do you? Wouldn't it be rude to ask one of the ambulances to go for Tim Hortons? We need all three here, so we did the right thing.
Yep, we did. And so now we're gonna do the Mercer way, which is the wrong way. I'm gonna do the last go down. And
You've seen the show. How long will it take the car to fill up?
about 60 seconds to 120 seconds.
That's like 1 to 2 minutes. Oh no, Jimmy, the bridge is out. The bridge is out. Hey, take your seatbelt off, come on.
So we've had lots of time.
Yeah.
And we could open the door now, but for whatever reason, many people wait. because they've been told they have to wait. Now the water's coming in
Right.
quite quickly.
No, I know, it's like an episode of Get Smart.
Okay, try and open the door.
Open the door. Right.
So now you can see, we've got the water out here.
The window will go down.
All right, get in the back.
Okay,
You naturally will end up going to the back seat, but please go, because I have to go too.
Okay, right. Okay, now the car is coming up here. Now where you go? Oh, what about? Okay, are we done now?
Well, we have one more trial. We can
Oh,
do.
good. So, class, we are showing that the only way to open a door once underwater is only when the car is entirely filled with water.
And the only way that a human usually can pull that off is if he has a scuba tank.
Right. Oh, here we go again. Okay, here we are. Seatbelt, seatbelt, seatbelt. See, I remember. There you go. Oh my goodness, look at this. Oh, look at this.
This is a sight you do not want to see. See, the roof is just caved in.
Where's that clear here? What is that?
This is pressure on the water,
Right. Cool. I'm glad you came up. Dr. Popsicle, thank you very much. And
Okay.
to you, Canada. Never leave your home.
All right, good, Eric. And just for the sake of time, let's just do the other one and then we'll finish up
Okay.
the last couple slides, because this one is falling through the ice, but
And what they have found too with the sinking, contrary to what Dr. Geisbrecht said, for people with electric windows, those windows will typically work for a couple of minutes. The headlights will stay on. The electrical systems nowadays don't short out that quickly.
unless
So
your
you,
car's electric.
well, unless your car's electric, but a typical car, the electric windows and the headlights will stay on, and they've got videos of the headlights on of completely submerged car. So, but still, get the windows down as quickly as you can.
We're only going to see the first, say, 5 minutes of this, but I do advise that everybody copy the link for this next video and watch the whole thing. But this is how you self-rescue if you fall through ice into a pond.
Well, tell you what, as much as I want to play it, just for the sake of time, let's skip it.
Okay.
So I'm gonna stop that.
All right. I
So-
am the back and share. Oops,
Maybe you could just put the link in the chat.
I did.
It is.
Perfect.
All
And this
right.
is a great video because if you're at a ski area, you have snowmaking ponds that are partially covered in ice most part of the winter. If you're an urban EMS, you've got ponds all over town that kids fall through, adults fall through, animals fall through. So great information for how to self-rescue.
Okay, so just to kind of pull it back together, I think most of us who are patrollers know this stuff, but Larry talked about the fact that cotton kills. So staying warm, you always want that synthetic base layer, and then insulating layers made of wool, down, some other synthetic, something that's waterproof over top of that for the outer layers, and then face, hat to prevent the radiation off the head. And then, of course, gloves and mittens, wool or synthetic socks, and only one pair. The more pairs people put on, you decrease circulation to your feet, and you're more likely to get cold feet and frostbite, actually. And of course, eye protection.
If you do a lot of winter traveling, some things to consider. Maintain your vehicle. Always have at least a half a tank of gas. If you happen to live in Florida right now, make sure your tank is full. Always carry some sort of emergency supplies. Just some suggestions: a flashlight, a good flashlight. Better yet, a headlamp. Because if you have a headlamp, you have both hands free. If you have to change a tire, if you have to do any skills, any skills out there, wear a headlamp. Some matches, candles, the ability to start a fire. a shovel to dig yourself out of a snowbank, ice scraper for visibility, some sort of brush to clean the car off, first aid kit, fire extinguisher. Most of these things are common sense. Wintertime sand or kitty litter to use as traction if you get stuck in the winter environment. Some sort of sealed emergency food and water, some sort of power bars, energy bars, peanut butter, high calorie, energy dense food that you can keep in your car, and some sort of water. If you have medications that are life critical, have medications with you all the time. Some gloves so you can change the tire, dig yourself out, extra warm clothing, blanket or sleeping bag if you have to spend the night in your car, jumper cables, flares, toolkit, windshield washer fluid, and a cell phone or car charger so that you can call for help. Check for weather and road reports before you go. Leave an itinerary with somebody reliable or a couple of reliable people, just in case you lose cell phone, you get lost, you get stuck. Somebody who's going to recognize that you have not arrived and can call for help. If you get stuck, make sure you clear the ice and snow from the windshield mirrors, lights, and roof. Never warm up your vehicle in an enclosed space due to the risk of carbon monoxide poisoning, and leave extra time and leave extra following distance. If you get stuck, try your emergency contact with your cell phone. Try 911. Don't venture into unfamiliar territory. Right, your car is going to be cold, but it is your shelter. Stay with your vehicle. You can turn your car on for short periods to preserve gas, but also to warm the car up a little bit. But remember to keep your exhaust pipe clear of snow and ice so that you don't poison yourself with carbon monoxide. When you get out of your car, and to clear the ice and snow away, clear your car off a little bit so that it's more visible to aerial reconnaissance. Whenever I rent a car, when I'm traveling in winter environment, I try not to get a white car or a gray car, because if I get stuck, nobody's going to see me anyway. Get a bright red one. You have your emergency food, high carbon, fat content, energy dense, some water, and tie anything you can do to attract attention. Colored cloth to the antenna. Don't turn your car dome light on all the time, because nobody will see it, and you'll burn the battery out. Just some general hypothermia survival if you're lost or stranded. Find or create a shelter, might be a snow cave, a tree well, a debris shelter, or even a plastic trash bag. Plastic trash bag is probably the simplest, quickest, and least energy requirement to protect yourself if you're stuck out. All of these other things take time. Make sure your exposed areas of the body are covered. Loose fitting layers of clothing, but multiple layers, so that you can dress up and dress down with the environment so you don't perspire and then get cold. If you're with friends, share body heat. So make sure you travel with people you like. You can produce heat through light muscle activity, but don't waste your energy. Avoid perspiring. If you can build a fire, do it. And drink warm beverages and food as you can. And just some examples of emergency shelters that we built in the backyard.
Okay, so I'm going to stop sharing.
Go to chat just so we
Okay,
can see if any.
yeah.
We're going to go to chat and see if there are any questions that people had posted
Or anyone can just tell me,
Or-
tell us.
or chime up.
Okay. I'm hearing Japan burrito or taco.
This is awesome. So, while we're waiting to see if anybody has any questions, I am going to put a survey in the chat. If you guys could all please fill that out. The goal is obviously get feedback for this class, and for Larry and Linda also, to give us an opportunity to get new ideas and find a way to make sure we're giving the highest quality classes as possible. Other than that, thank you for your time. I'll stay on a little bit longer in case
A
anybody has
question.
questions.
We appreciate everybody coming and being here.
Hans has a question.
Yeah, Hans?
So, for rewarming, everybody's had cold hands and cold feet, and then it hurts a lot. It doesn't have to be frostbite. It can frost nip will hurt. I wasn't sure of that, or
Yeah, very much so.
Yeah. Yeah.
it doesn't mean you've been necessarily frostbitten. Only if you have pain rewarming.
No, frost nip will hurt to rewarm, but frostbite in particular,
Mm-hmm.
the pain from frostbite rewarming is opioid quality pain relief. You know,
Got it.
yeah.
It's very bad.
I probably couldn't even imagine. Even from cold hand, it's cold. It hurts to rewarm. Thanks. Thank you.